I'm Mary Beth, Olympus Clinical Applications Specialist. Did you know that EUS scopes have special air, water, and suction valves? Let's review the EUS scope valves. EUS valves are interchangeable between the radial and linear EUS scopes, but cannot be used on other scopes such as a gastroscope or colonoscope. You'll notice that these valves are larger than standard valves and that the suction valve has a second prong that is inserted into the balloon channel of the EUS scope. When the air-water valve is completely depressed, there is a hole in the valve stem. Ensure the hole is completely visible. Sometimes the valve needs to be popped so the hole can be visualized. If the entire hole is not visualized, there may be issues inflating and deflating the balloon, the valve leaking, or the scope tip leaking. There are O-rings on the valves that, if nicked, will cause issues with suction or inflating and deflating the balloon, and the valves would need to be replaced. The valve should be inserted into the housing very gently. Placing a finger over the hole of the blue air-water valve infuses air into the lumen, just like with any other scope. Pressing the blue valve halfway to the first stage will allow water to clean the lens. Pressing the blue valve all the way to the second stage will inflate the balloon with water. Pressing halfway on the red suction valve will allow suction or deflation of the lumen. Pressing all the way will deflate the balloon. To review, pressing halfway on each valve is the scope function. Pressing all the way on each valve is the balloon function. If you have questions, please refer to the instruction manual for detailed instructions or call your local Olympus Clinical Application Specialist.